Hey, everybody, this is Dr. Craig Kasper from NYHD and the Institute for Hearing and Balance based in New York. And today we're back with another episode of the Audiologist at Home episodes, which is basically we're at home, you guys are at home. We figured we would provide some insight and some answers to questions that we get on a day to day basis in our practice in the world of hearing and balance disorders. And today I have my colleague, Dr. Zweig. Hey, Dr. Zweig, how are you?
Oh, good morning.
Good morning. How's everything there in Brooklyn for you today?
Looking out the window, it is sunny. Looks like a nice day. Hopefully, I'll get outside.
Yeah, I think everything's starting to look up. We're getting some positive news here in New York regarding coronavirus and hospital admissions and all of that. Unfortunately, there's still a lot of people sick but I think that we're starting to turn a corner here, hopefully.
Yeah.
So today we have a question that is really interesting. It's in the world of how we assess dizzy patients and kind of one component of it. And the
Okay.
question is, what is nystagmus?
Okay. So, nystagmus, despite the fact that we deal with the ear, is actually a vision condition in which the eyes move in a repetitive or rapid uncontrollable movements, whether it's from side to side or up and down. Sometimes it could be rotary, which is kind of in a circle. Uh, the reasons for nystagmus aren't always related to the ear. Sometimes they are congenital. So from infancy, infants usually, what I've read has been from about 3 weeks to, you'll find it between 3 weeks and 6 months old. Um, Usually doctors are not sure why the infant might have nystagmus. Sometimes it is passed down from a parent, or it can be acquired, which happens a little bit later in life. And causes of acquired nystagmus can be things like sometimes drugs and alcohol, can be central disorders such as a stroke, multiple sclerosis, um, epilepsy. Sometimes it's a result of head injury. The way that we look at nystagmus is more through the inner ear, because nystagmus is also an indicator that there might be an issue in the vestibular system in the inner ear. And during our testing, we are assessing nystagmus or eye movements to determine ear-specific information based on the direction of the nystagmus, based on the speed of the nystagmus. Whether it's rotary tells us a lot of information, so whether it goes in a circle, up and down, and we can kind of pinpoint specifics about the vestibular system, whether it's both one ear, central. So I'd say in the general sense, that is what nystagmus is.
Yeah, it's interesting because oftentimes you can see nystagmus by just eyeballing it. Literally, you as the clinician looking at the patient's eyes.
Mhm.
Sometimes it's not as evident, and you can't get as much detail by just looking at the patient's eyes. So what we do is we put on some goggles. They look like virtual reality goggles, and they have cameras in them, super sensitive, so you can actually see very subtle movements in the eye as a result of, say, body position changes or things that might do with introducing temperature changes to the inner ear, one ear or the other.
Mhm.
So that gives us a ton of information if it might be an ear issue, or maybe if it's something else. And if it is an ear issue, depending on, as you were saying, the direction of the nystagmus, might tell us what part of the inner ear might be involved as well. And then ultimately that can lead to us helping with treatments to
Right.
help the person get better. It's interesting because I always think of nystagmus, the first image that comes to mind that might be a good visual for someone out there is if you kind of, as a kid, if you spin around on a merry-go-round and then you stop and you look at the other person's eyes and you can see the eyes just beating.
Mhm.
That was my first visual of nystagmus, and that's exactly what we're talking about. So
And we have something in our office that spins people around, so we can actually assess it that way too.
that is true. Yeah, the rotary chair, which
Yeah.
is a very expensive merry-go-round. So
Fun.
awesome. So that was great. Yeah, nystagmus is a very interesting topic, and as we were saying, that it's kind of the window into the diagnostic process for us, and for anybody else who's dealing with vestibular disorders. So
Mhm.
awesome. I appreciate your insights as always, Dr. Zweig.
My
And
pleasure.
yeah, and if any of you have questions out there, you can always send them to the info@newyorkhearingdoctors.com email address. We'll do our best to get to them during the time that we are in our homes. And with that, I will say thank you, Dr. Zweig. We'll talk soon.
All right. Take care.
All right, take care, everybody.